Okay, thank you everyone for coming today to our Lunch and Learn. We will begin shortly. Just give it a few more minutes to see if any more participants will join. Okay, Adam, are you ready? Do you want to start?
Yeah, I think we should get started. Thank you.
Yep.
All right, so welcome everybody to the April OHA Lunch and Learn. We'll be talking about ambulance coverage and charges. My name is Adam Prizio, and I am a staff attorney here at the Office of the Healthcare Advocate. I don't think that I see Ted Doolittle, who is the healthcare advocate, on the line, so I will do the introduction to our agency, and then I will tell you some things about ambulance coverage and charges. So what is the Office of the Healthcare Advocate? We are a small state office that was created in 1999 as the Office of the Managed Care Ombudsman. Our name was changed in 2005 to the Office of the Healthcare Advocate. We consist of a staff of nurse consultants, attorneys, paralegals, and other professionals whose job it is to assist Connecticut consumers with healthcare and health insurance issues. So the example is, one of our sort of bread and butter case is if your doctor orders a procedure, says that you need, let's say a CAT scan, and your insurance does not believe that you qualify. They don't think it's necessary, and they're not going to pay for it. They send you a letter, and that letter says on it, we're denying your request for coverage of this procedure, and if you disagree with us, you can get assistance from the Office of the Healthcare Advocate. That assistance is free to consumers who are Connecticut residents, as well as to anybody who is covered by a plan written in Connecticut. So there are some folks who maybe live over the border in one of our neighboring sister states. We help you to the extent that we can to straighten these things out. Next slide, please. So we're going to be talking about ambulance coverage, and I've created this slide. This slide is probably going to be a mainstay of future lunch and learns because the law of health coverage and health benefits is sort of fractured, and different laws apply to different types of coverage. So there is coverage which is called fully insured. This is what you and I might think of when we think of the word insurance. Fully insured plans are regulated by the state of Connecticut, and they must comply with both state and federal laws regarding health insurance. These are, for instance, the plans that you might buy through Access Health Connecticut, and some employer-based health benefits are fully insured plans. There's also a type of health benefit that you can get from your employer called self-insured. Those plans are regulated by the federal government, but Connecticut laws do not apply. So if you have an employer-sponsored health benefit, you might not know. You might have to find out from your employer what type it is, and then that will determine what of the laws that I'm going to be talking about today may apply to your plan. And then there's sort of a broad category that I'm calling public plans, which includes Medicare, Husky, which is known at the federal level as Medicaid, and TRICARE, and each of those has its own body of law and regulation. Next slide, please. So something that folks come to us with at times is that they get a bill from an ambulance company, or they get an EOB from their insurance, an explanation of benefits that says you had an ambulance ride on such and such a date and you're being charged this amount. And people want to know, where are these amounts coming from? And the answer is that they are set annually by the Department of Public Health, which is a Connecticut state agency, in the Office of Emergency Medical Services. These establish what an ambulance company may charge for different types of rides. That doesn't mean that these establish what your insurance will cover, as we'll talk about. The rates are set every year based on cost reporting from ambulance companies. And in my research, I was not able to find the final rates posted in a place that's publicly available. I was able to find proposed rates, but the proposed rates are not necessarily the finalized rates. So I did not include those. Next slide, please. Connecticut law requires fully insured health insurance, right? That's the insurance that's subject to Connecticut law. Requires health insurance policies that are issued in this state to provide coverage for medically necessary ambulance services. The two statutes are on the slide. The one is for individual coverage and the other for group coverage, but they say substantially the same thing. The key provision is that the policy shall, as a minimum, cover ambulance services whenever any person covered by the contract is, that is to say, a member, somebody who's the subscriber or their dependent, when they're transported when medically necessary by ambulance to a hospital. These benefits shall be subject to any policy provision which applies to other services, and the policies shall not be required to provide benefits in excess of the maximum allowable rate established by the Department of Public Health. So there's a couple of limitations there, which we'll get to. Next slide. Federal law includes ambulance services as emergency services under the Affordable Care Act. So both fully insured and self-insured plans have to cover the ambulance services under the emergency services if they are to be considered qualifying health plans. Next slide. Medicare ambulance coverage under Part B of Medicare covers medically necessary ambulance rides to hospitals, critical access hospitals, rural emergency hospitals, and skilled nursing facilities. Ordinarily, there is a 20% co-insurance, so you'll pay 20% of what Medicare specifies as the amount that it'll pay. You can get a Medigap policy, supplemental insurance to cover that 20% if necessary. Medicare Advantage plans have to cover at least this same benefit, and this is true of all the benefits of Medicare, is that a Medicare Advantage plan is supposed to cover at least the same amount, if not more. If you're on Medicare and an ambulance company thinks that they're providing you a trip that Medicare will not cover, they will require you to sign an ABN, an advanced beneficiary notice, which says essentially that you agree that if Medicare doesn't cover it, you will pay out of pocket. Next slide. So I want to talk a little bit about the limitations of this coverage. Coverage does not mean without cost share. And what that means, a lot of times we talk to folks who sort of colloquially use the term coverage to mean what my insurance pays. But when the law requires insurance to cover things, it does not, unless it specifies that does not mean that there's no deductible, there's no copay or other cost share. So both Connecticut and federal law allow ambulance claims to be applied to your deductible and your cost share. Now, you may have heard that these bills referred to as surprise bills, right? You call an ambulance and then you get a big bill and you're surprised by it. So are there surprise billing protections? And the answer, as is the answer with a lot of these things, is that it can be complicated. We'll look first at the Connecticut surprise billing law, which gets into which does provide some protections, and then the Federal No Surprises Act at the end. Next slide, please. The Connecticut surprise billing law, you can see the statute segment there. It includes emergency services as a protected category of surprise billing, and that means emergency medical screenings as defined under a federal law, which is EMTALA, and I'm not going to remember what that stands for, but it's the Emergency Medical Treatment Something Act, which includes hospital-affiliated EMS systems. The Connecticut surprise billing law says that claims for emergency services have to be covered at the in-network level. That's your in-network deductible, your in-network cost sharing. Remember when we talked at the beginning, Connecticut surprise billing law is part of the Connecticut Insurance Code, so you may be covered by an employer-sponsored plan to which this surprise billing law does not apply. In which case, you only have the rights that the federal statutes give you, and we'll talk about those in the next slide. So the Federal No Surprises Act covers air ambulances, but not ground ambulances. And this is, I think there's been a good amount of discussion about this among different consumer health groups as to why this should be, and was this an intentional oversight? What's going on here? But the fact of the matter is that ground ambulances are not covered under the No Surprises Act. Air ambulances are covered, and they're not allowed to balance bill consumers. And that's the protection against surprise billing. So, previous slide. So a balance bill is not, a surprise bill is not just a bill that surprises you, but it's when you unwittingly use an out-of-network provider, and then they take advantage of the fact that they are an out-of-network provider to charge you more than your insurance company will cover, which is what balance billing is. And it's worth going over this a little bit. Balance billing is the difference between the adjusted amount and the billed amount. So for example, let's say that you, I just used a round number here. Air ambulances are a lot more expensive than this, but let's just say for a round number, you use an air ambulance and they charge you $1,000, and they are out of network, and your insurance company adjusts that bill down to $800. They say, $800 is the usual and customary rate. This is what we pay for an air ambulance like this. And they further apply, let's say, $500 of that to your patient responsibility, your deductible or whatever. They pay $300, and they say you owe $500 of this amount. An in-network provider would not be able to balance bill that difference, the $200 that they shaved off when they went from $1,000 and adjusted it down to $800. But an out-of-network provider, under ordinary circumstances, would be able to balance bill you. So they'd be able to charge not just the 500, which your insurance says is a patient responsibility, but the additional 200, which was adjusted out. Under the No Surprises Act, an air ambulance is not allowed to balance bill. So if you get a balance bill, if you get a bill from an air ambulance, you should certainly give us a call and we can make sure that your rights are being protected here. That is my brief overview of the laws relating to ambulance coverage and charges in Connecticut. There's some time for questions, but the most important message and takeaway from all of these lunch and learns is that the Office of the Healthcare Advocate is here for you. We're here to answer your questions. We're here to help you deal with these complicated and sometimes fractured regulatory systems that have different rules that can be confusing for folks. So please get in touch with us. Our email address and phone number and mailing address are on the slide. And now I have a little bit of time for your questions, if anyone has questions. Denise, are people able to unmute themselves or should they put questions into the chat?
They can put questions in the chat, but yeah, they can definitely unmute themselves.
Excellent.
We'll give it another minute for some questions, if there are any. Okay.